Hello everyone, Sonia Liebendorfer here. I just wanted to do a quick video about the different treatments that are available for the familial type, the ATTR type of amyloidosis. And I'm not going to cover the non-TTR tonight. I'm just going to briefly go into the treatments for this particular type of amyloidosis because of the not much information is allowed to be given as far as treatments. There's some really tough restrictions on what's allowed to be told. Don't know why that is, but that's the way it is, to the point that they put cookies in your search engine if you try to find answers. So why they're so restrictive, I don't know, but I'm giving you the information here that I was able to find quickly and without getting too many cookies attached to my search engine. So let's go ahead, shall we? All right, the first thing I want to talk about is the supportive measures that are available. They can do a lot of treatments as far as physical therapy for the neuropathy and the carpal tunnel symptoms that are associated with the familial type, and they can minimize the nerve irritation. Either they can use exercises or they can use braces on the wrists. They also can use ice therapy to relieve it. And as far as the nutrition and adequate hydration, the physicians will have to monitor that by watching their weight and watching if they have a lot of edema from poor protein intake and their body not holding on to the protein, and they start to have kidney problems or problems with not being able to pass urine. Those are signs that things are getting worse. So they can monitor for all of that medically, just to see if there are any changes going on that they need to go ahead and address before they really become problematic and could even shut down the kidneys if the output gets to where it's minimal. They also have come out with medications, and I don't know why there's such a restriction on what you can say about the medications, so I'm only going to be covering them very briefly, because it really states they don't want you to talk about them unless you are a medical professional, which I am, so I don't have a problem with that. But I don't like the drugs that they have available for this, and I'm going to explain why. There has been a big push over the last few years with biologics, and I'm not a fan of biologics. And I'm not a fan of biologics because I have seen what they do to people. I used to be an educator for the drug Humira, and I stopped because a friend of mine had a family member who was taking Humira, and whenever she went swimming in Florida, she ended up with a horrible case of necrotizing fasciitis. If you don't know what that is, it's a flesh-eating bacteria, and it almost killed her. She lost, I think, 89% of her skin was eaten away. So after that, I quit doing any kind of education for biologics, and I've really been turned off to them because I realize how much they really impact your body's ability to have an immune system response, because they have the suppression type effects of corticosteroids. And of course, corticosteroids make you prone to catch anything. And if you listen to the commercials for a lot of these biologics, they say that it can make you predisposed to being more at risk for TB and all this other stuff. So it affects your body's ability to fight off things, and I really think that in the long run that's not a good idea. The other thing that I'm not really keen on about the medications that they promote is just like the coronavirus vaccine, these change the DNA sequence through the RNA, and I'm not a fan of that either. And I think that this was maybe one of the first ways they were looking at changing RNA before all this coronavirus crap came out. But it definitely was come out with in 2018. And I really question the timing of all of this when it was started to look at as an RNA answer to this problem. So that's all I'm going to say about that. We are going to go into the medications briefly. I'm not going to go into them in detail because I'm not going to overwhelm you with a bunch of medical jargon. But I do want you to know that there are options out there. I'm going to tell you about those options, even though I'm not a fan of them. If somebody is dealing with this problem all the time, they might want to consider them. But as far as biologics and RNA medications, that's just not something that I will do myself, and I don't encourage anybody else to do it unless you really see there's going to be a true benefit that outweighs any risk that you may have. All right, so the first one is this Onpattro, and it is the one that is an RNA interference therapeutic. It doesn't really talk about this medication a lot as to how it's given or anything, where it does say that about other medications, which just really makes me leery of it when there's not any information out there that I can find with ease. And but it's supposed to silence the gene expression, which just basically means it makes it where it's not supposed to present itself, and you're not supposed to have problems with the carpal tunnel. Now, these are strictly the neurological effects that we're talking about with these medications. Now, the other thing is the Tegsedi that they came out. That is a sub-Q injection like an insulin would be, but it's a sub-Q injection that you give weekly to reduce the production of this particular protein. Now, it doesn't really keep anything from misfolding. It doesn't really keep anything from forming abnormally, but it just totally reduces the production of that protein altogether, which is not really a good thing if you take into consideration that the whole purpose of this protein is to transport thyroxine for the thyroid and also to be the transporter of vitamin A, the retinol. So the retinol binding protein. So that's not necessarily a good thing. And that's why I'm kind of leery about this stuff because, well, RNA, to me, you shouldn't be messing with anybody's genetics anyway. I'm sorry. It's just the way I feel about it. It's wrong. And you don't know what effects this is going to have for people's offspring on down the line when you start giving them these biologics. That's another thing I have a problem with. And the sub-Q injection reminds me too much of the Humira that I used to teach people about, that inhibits the protein, but it doesn't necessarily mean that that's a good thing for the simple reason that it's a transport protein. So it doesn't say that it helps with the misfolding, it just says that it reduces production. That's not necessarily a fix. A way to get money, but not necessarily a fix. Now, in 2019, they came out with 2 medications for the actual cardiomyopathy that is associated with this type of familial amyloidosis. And the 2 medications that they came out with were Vyndaqel and Vyndamax. These are oral medications, thank goodness. No needles involved with these. And they are medications that you can take once a day. But this is for the cardiomyopathy drugs that they have come out with. And again, I said, they are very tight-lipped about this stuff and what's contained in it and what it is supposed to do. But if you want me to do some more digging, I'll be happy to. Just let me know in the comments. All right, now as far as for future research, the monoclonal antibodies are what they're looking at to use to specifically target and clear the misfolded proteins. So, like I said, that other medication they said that were to reduce production, it doesn't mention anything about stopping the misfolded proteins, and I don't think it's because they know how to do it yet. But that's something that they're working on trying to find a medication to do. The solutions for these problems are continually evolving, so stay tuned for further updates. All the information that I got was from the Amyloidosis Foundation. They have a lot of good information there for patients and their families, and I encourage you to stay tuned because any updates that they have, the information seems to come out from them first because they are the most hands-on with this particular type of condition. And I'm sorry this is so brief today. I don't know why they have such restrictions on what they are wanting you to say about the medications that are available for this, but they are very clear that they don't want you talking about it. To get any information at all, you have to be willing to allow them to put cookies in your search engine. You have to also verify that you are a health professional. So it's all very tight-lipped, the work that they're doing here, and I'm not quite sure why they're so strict about it, but don't want to step on anybody's toes at this point because I do want to continue on with the series, but I just want you to be aware that they do have a lot of restrictions in place as far as what you are allowed to know if you are not a medical professional for whatever reason, and even then they restrict us to really knowing a whole lot. In closing, I want to thank you very much for being here today and for spending some time and learning more about the treatment options that are available for amyloidosis because it seems to be a big problem with people in Europe and with people that are from that area of the world. And there is a big component of my mother's side of the family, of her mother, that is from the UK, and I think that this may be a problem that we have in our family. One of the reasons I had to cut the presentation short is my carpal tunnel today is giving me absolute fits. I have had my wrists on ice today to try to minimize the burning pain. So that's why another reason I had to keep this brief and to the point. So I need to rest my wrists for a couple of days. So you may not see me until next week, guys, but I'll get something uploaded as quickly as I can. But right now I need to rest my wrists because my carpal tunnel is really acting up since I have been working on the piano and working on laying some songs. It's really flared up rather badly. So just keep me in your prayers about that so I can get back to what I'm supposed to be doing in helping out with education and also getting all my songs recorded that I've been working on all these years, and I just haven't taken the time to sit down and record them. So just keep this in mind that I need your prayers for my wrists, and please thank you for being here. I greatly appreciate it, and like and subscribe if you haven't already. If you learned something from the content, I'm sorry I couldn't provide more information, but for some reason they're just extremely tight-lipped. But if you do want more information, I can try to get it for you. Just leave a comment that you'd like some more information on it, and I'll do what I can to get that information for you. Have a great night. Take care. God bless. Bye.